Hello there and welcome back to another edition of The Verdict. Mick Cornett with Kent Myers. We're here every week meeting interesting people and dealing with topical issues, and we're going to get a little health related this week.
Yes, we're going to have Dr. Glynn Lytle come on and talk to us about the Oklahoma Foundation for Medical Quality. They've got an awful lot going on. They're a wonderful organization here in Oklahoma, and under Dr. Lytle's leadership, they're engaged in some efforts that will help all of us.
We have trouble with heart disease in Oklahoma. It's men and women, it's across the board, and there's a number of things that can be corrected. So let's have a discussion about it today on The Verdict.
We'll talk about the ABCs.
There you go, the beginning.
Prevention. Yes.
We'll be right back.
Well, prices at the pump are hitting new highs this week. In other news,
gasoline is expected to top $4 a gallon this week.
expect drivers seeing sticker shock at the pump.
OPEC has raised the price of oil again, and Wall Street worries.
Well, a full tank of gas is going to set drivers back.
Straight ahead, the latest news on
If you need big accounting firm expertise but aren't happy with the value or level of partner engagement from your current national firm, contact Hogan Taylor. Hogan Taylor provides national-level public accounting expertise with high-touch, local partner service in all areas of tax, audit, business valuation, and litigation support. Contact us at hogantaylor.com/The Verdict. Hogan Taylor, big enough to know, small enough to care.
Welcome back to the set of The Verdict. Mick Cornett with Kent Myers, and Kent's going to introduce today's guest.
Today we're really thrilled to welcome a transplanted Oklahoman to our show, Dr. Glynn Lytle. Glynn is a medical director for the Oklahoma Foundation for Medical Quality. He did his undergraduate work at Princeton University, where he graduated magna cum laude. Did his law work, or his medical work, at the University of Rochester. Got a master's in health administration along the way. He has had extensive, over 30 years of private medical practice as a surgeon and otherwise. And in the administrative position he's in now, he began his service in January of this year. As I say, he is the current director, the medical director of the Oklahoma Foundation for Medical Quality. This is his first visit to The Verdict. Dr. Lytle, really glad to have you.
Well, I'm really glad to be here. Thank you very much.
Tell us about the Foundation for Medical Quality. What is that about?
The Medicare and Centers for Medicare and Medicaid developed a system called the Quality Improvement Organizations, and every state has one. And Oklahoma Foundation for Medical Quality is the QIO, or Quality Improvement Organization, for Oklahoma. We've been around for 40 years. That's one of the reasons I'm very excited to be here, and basically have served that purpose for the government since we've been here. It's an interesting type of company because we don't provide medical care, but we watch over the Medicare beneficiaries and what kind of care they're receiving. Mm-hmm. We're not looking so much at the fiscal portions of it, but the quality of care. Mm-hmm. Make sure the right tests are done, that the right things are done for the patients, and that they understand what's going on.
What are you seeing? How are Oklahoma doctors doing?
Well, I think Oklahoma doctors are doing great. You know, there's so many regulations that come down every year on both hospitals and doctors that it's so hard for a doctor who's trying to do the right thing to keep track of all those things. So that's one of the things we do. We help to keep them within the regulations. Some of the rules of these measure reportings that hospitals have to go through, there's almost no way a hospital can figure all that stuff out. So that's one of our jobs, is we help them with that. We go in and we explain the rules, try to get them through the different reporting periods. And then when something as brought to our attention a quality issue with a physician or a hospital, we review the charts and decide if there really is a quality issue. We don't have any power to punish anyone with those things, but once we find a quality issue, we turn it over to the proper authorities for that. And all the time we're hoping, we'd love not to find any quality issues. All the time we're hoping to be improving medical care. And as the go-to person for Medicare in Oklahoma, we also try to just improve the quality of healthcare throughout the state. Medicare really leads the way with a lot of things in the state, no matter what age you are and what kind of insurance you have. Once Medicare has established certain things, others usually follow suit. So we're trying to do a bunch of things to try to improve the care. Oklahoma, unfortunately, has been ranked 47th, 48th, 49th in the country as far as health care for a long time. And if we could do something about that, that would be a great step forward.
When you say ranked about health care, you mean quality of care?
Well, there's a variety of parameters they look at, and they look at rate of heart attacks, they look at the age of death, they look at the smoking, they look at a bunch of characteristics. And unfortunately, we're way up there every time with all those characteristics. So we try, one of our jobs is to try to see what we can do about improving the health care in Oklahoma.
Is your organization one that will receive complaints or input from the patient?
Absolutely. We have a whole section of our department, the beneficiary section, that receives hundreds of calls all the time. And sometimes it's just a matter of lack of communication between the provider and the patient, where they just didn't understand what was going on. And sometimes it's questions about why do they say I can't stay in skilled nursing care anymore? Why are they saying that my time's up and things? And then there's other times where they bring up quality concerns, and we're able to address all those aspects. When we think there's a quality concern, then we look at the charts and we review them. We have a bunch of dedicated physicians across the state who help us with that, with the peer review, with looking at charts for us, and then we make our conclusions after that.
We don't do very well in the statistics, especially when it comes to heart disease.
You know, heart disease is a big problem throughout the whole country. But Oklahoma is the leading cause of death for both men and women. And, we have a bunch of risk factors that we've never been able to really get a good handle on. You think about the risk factors for heart disease and smoking, obesity, cholesterol levels, and blood pressure problems are all part of that. And so much of Oklahoma is rural. So many people don't have a primary care physician, don't have a place to go to routinely get preventive care. We just don't rank very well with those things. And one of our pushes right now is there's a program nationwide called the Million Hearts Program. And we're the lead in Oklahoma for that program. The basic premise of the program is prevent 1 million heart attacks over the next 5 years, which is a bold statement. But when you think about it across the whole country, it's not as bold. And it's a pretty simple process. They got it down as many things get down to just the ABCs.
I stole your line.
That's okay. That's okay.
What does it stand for?
A is for aspirin. And not everyone should be taking aspirin, but a lot of people should.
Yeah. Now, is that in addition to a cholesterol medicine or in place of a cholesterol medicine?
In addition.
Okay.
And certain patients would certainly be prime candidates for taking this.
Like who? I mean, just in general.
Well, patients who have a high risk of heart disease in the family, or maybe someone who's had a previous heart attack.
Right. So it's not necessarily by age, but it can be by family history.
Absolutely.
Or by just how likely you are to take it.
Absolutely. And even though we're an organization that deals with Medicare, this Million Hearts program is everywhere. So,
let me ask a dumb question. Because aspirin sometimes is replaced by Tylenol or another pain reliever, those drugs don't provide the same thing that aspirin does.
No, it's both the anti-inflammatory effect of the aspirin as well as its effect on the platelets, which are those tiny things in the blood that help to make blood clots. So that's the effect that we want with aspirin.
Right.
Going on with the ABCs, B is blood pressure. Our goal is to have your systolic, the higher number, less than 140, diastolic, the lower number, less than 90.
Now,
And
what typically drives that up?
Oh, it could be family history. It can be stress, and it can be genetic. It can be all sorts of things. You know, one of the things that we always worry about is the intake of salt.
Yeah.
And that'll increase people's blood pressure. So there's a lot of lifestyle changes that people can make for blood pressure. Plus, there's a lot of good medicines around that certainly can help. The third of the ABCs is cholesterol, lipid management. And again, you know, that's something you can't manage unless you get it tested. So, you know, we're really trying to push to get things tested.
The lower the better on your cholesterol number?
In
the
general,
bad HDL?
there's several different things that we measure, and there's one called LDL, and there's one called HDL. And the LDL, the only way I remember it, L for lethal, that's the bad cholesterol.
Okay.
And then the HDL is supposed to be the good cholesterol. We're not sure how
healthy.
good it is. Yeah. LDL should be less than 100. HDL should be more than 40. So, but unless people get those measured, then you know, you're really stuck about who to prevent.
I thought they were saying under 200, and now you're saying under 100.
No, that's total.
Total cholesterol.
Oh, I see, total together. But you're saying, in general, the lower the better. I mean,
Absolutely.
150 is a lot better than 200.
Right.
200 is better than 250, but 150 is a lot better than 200, and,
Right.
and so on down.
And you know, and sometimes people will go and get some of their care and sort of maybe an urgent care center or something, and they're not going to take care of that kind of thing for you. They're not going to take care of your cholesterol. And if you are on medication, you need to have it checked again to make sure the medication has achieved a target level for you.
Yeah.
So, so cholesterol is a big issue. And then ABCs, the last S is smoking. And smoking is still a problem in Oklahoma. And it's certainly a problem with heart disease. Smoking affects how your blood vessels work and certainly increases the risk of heart attacks and stroke.
We're going to come back and do more with Dr. Lytle. We're talking about heart disease and a lot of other things that have to do with the Foundation for Medical Quality. It's Today on The Verdict, and we'll return after this.
The thing that has made the most sense for me is realizing that I am still an educator, and that is what I do at the Chickasaw Nation. I'm Dr. Amanda Cobb-Greetham. I'm a historian, and I'm Chickasaw. The Chickasaw Cultural Center is amazing. It is a very, very special place devoted to the sharing and to the celebration of Chickasaw history and culture. State-of-the-art technology, exhibits that are not like anything I've ever seen. The Spirit Forest is incredible, and you feel as if you have actually just walked into a forest with huge trees all around you. It's timeless, and yet it's sort of also representative of our time depth, to really just sort of reach through time and touch the past. By the end of the exhibits, you really have a sense of Chickasaw cultural and political resurgence and the extent to which we are a healthy, dynamic, and vital tribe today. Chickasaws have always been an inclusive people. This is something for the whole community and for the state of Oklahoma.
Hear that? It's the sound of an industry, 83,000 strong, creating jobs for nearly 350,000. A $52 billion a year being pumped into our economy. It's the sound of Oklahoma's oil and natural gas industry, our heart for the state, and our people. And it beats on and on and on.
When you have something important to communicate, it becomes clear that there's a lot of competition for your audience's attention. So how can your message stand out and actually resonate with your audience? Legal Graphics has the answers. The team at Legal Graphics will work with you to plan, design, and even test your presentation to ensure your message will be heard and remembered. Call Legal Graphics today to schedule an appointment. The readiness is all.
Welcome back to the set of The Verdict. Dr. Glynn Lytle is our guest. We're discussing the Foundation for Medical Quality.
Doctor, tell our viewers about your organization. I noticed your name includes the word foundation. What kind of an organization are you, and where are you located, how many employees, and the like?
Okay. We're a small organization. We have about 70 employees. We're located here in Oklahoma City over near Quail Springs Mall. We have been in business for 40 years, which is one of our big pushes this year. It's our 40th year anniversary. We have several divisions within the organization. We have some employees that work remotely. We have an employee in Virginia and some in Colorado, so we're not all in Oklahoma City, but primarily in Oklahoma City. We cover the whole state for this project, the quality improvement. We're different than most of the quality improvement organizations across the country. Virtually every state has one. But we have a couple of additions. We also have a regional extension center, which is part of ours, which is right now working on helping doctors get through the electronic records and helping get them established. When they first formed the regional extension centers, there were only 12 of them, and we had one. The other thing we have is an organization called Measures. Each hospital has to report on certain things all the time, and we're the steward for those measures. We maintain those measures, we check the literature to make sure that they're all evidence-based medicines and things. So we have a much broader impact than just Oklahoma.
What relationship does your organization have with Medicare and other government-sponsored programs?
Medicare sponsors our organization, and that they're our prime contract. We have some other contracts besides Medicare, but they're our prime contract. So every year they come up with, or every 3 years they come up with a new scope of work where they decide what things they want us to work on, and that's what our job is to work on those things.
And that edict comes from Washington?
Yes, Health and Human Services.
I was interested, and you were kind enough to invite Mick and me to your 40th anniversary. I was surprised to find that your organization had been around 40 years. Tell us about the anniversary celebration and what's going to happen.
Well, it's going to be a fairly low-key celebration, but we're going to hold it over at the Western Heritage Museum. And one of the things that's going to happen is we're going to try to relate some of the 40 years of history of the organization. I've only been there about a year, so I'm not the one that's going to do that part. And then we also have created a new logo for our organization. Our name, Oklahoma Foundation for Medical Quality, is an awful long name. OFMQ, our acronym, is much easier. But we're trying to come up with a new logo that maybe will show some of the thought about what we're heading into. We're trying to expand beyond just what we've already done in the past.
Well, where do you stand on wellness? You know, we're talking a lot here about acute care, but how does wellness play into your role?
Practically everything we do. I mean, preventive care and trying, this Million Hearts thing is obviously very much preventive, and trying to aim to improve the quality of healthcare. You know, we work in so many different areas that we have people that are working out at the nursing homes who are trying to prevent pressure ulcers and trying to lessen the use of restraints in nursing homes. We have people working on what's called care transitions. You know, 1 out of 5 Medicare patients who's discharged from the hospital will be readmitted within 30 days. Well, that's terrible expense. We need to do something about that. And discharge has always been a hospital thing. But then we realized that we need to start thinking about not that they're just discharged from the hospital, but they're admitted to home, that we need to have the people available to help so we can get through that transition period. So that's another preventive issue. There's so many projects going on. You know, one of the great things about my position as medical director is I get to sort of go in on all those things. Most people work in their own little areas, and I get to see all of it. And you know, with the 70 people we have there, incredible talent. A lot of them are nurses, some are specialists in analytics. We have a whole department that helps look at the data and is able to come up with what it all means, which is, I don't know how they do that, but I trust them when they do that. And then these people that are involved in the Regional Extension Center that are involved in the electronic records and trying to improve the care through that. You know, talk about prevention. Electronic records has got a huge role in prevention.
How's that?
Well, when I was in practice, I mostly practiced as a surgeon, but you know, you wouldn't always think about all the things that you needed to think about with any one patient. You got focused on their primary problem. Electronic records will have ways of bringing up, this patient hasn't had a colonoscopy in the last 3 years, this patient needs another cholesterol check, things that you just help remind you, and so you can keep on track. And then all the data is there, so you can look at it. You know, repetitive tests are done all the time just because someone doesn't know where the results are. Electronic record is going to reduce the cost of medicine once it's fully implemented. That's the struggle we're going through now, the sort of the birthing.
Well, I'm so pleased we're doing this show now, but it seems to me that your role is just going to increase in importance as our population ages and more folks get covered by Medicare. More and more folks are going to need your watchful assistance. Are you planning for an increase in the number of Medicare patients?
Well, there's no doubt about that. It's one of those growth industries for us, and it's going to keep getting bigger.
And is that because of the demographic changes, or are there other factors?
Oh, I think it's just that we're an aging country.
Right.
I mean, so many
The baby boomers, yeah.
I mean, we've almost reached that age, or have reached that age. So it's going to continue to be a big issue, and obviously all these issues about how to pay for care and all that are coming down too, and somewhat confusing, and then somehow gets very political when you think about some of those issues. Fortunately, in our situation, we can primarily concern ourselves with quality of care, make sure adequate care is being given to the Medicare beneficiary, make sure there haven't been any lapse of the care or any mistakes that have been made that should be corrected, but all with an eye to improvement. We'd much rather correct the situation and move on and try to have a physician do a better job in the future than necessarily find the bad apple in the crowd. And that's really the way quality is anyhow. It used to be you try to find the bad apple, get rid of them. Now what we're trying to do is find the good apple and get others to copy that, to set up evidence-based medicine, some models and things so that people can say, yeah, that's a better way of doing this. That's the way we should do it. And the neat thing is that most time the quality way is also less expensive.
Yeah. Are the procedures pretty standardized for what a Medicaid or a Medicare patient is going to get, or can doctors use some level of creativity in their own style?
Well, I think there's quite a bit of creativity and things, and we don't really get to the level of trying to interfere at all in the practice. But if we see a trend where perhaps someone's overusing some diagnostic tool that just isn't necessary for what they're doing, that's just costing money. So that's the kind of quality issue that we would attack. We also attack things like, we're involved with transfer of patients. Patient comes to a local small hospital emergency room with a condition they can't take care of. They have to be able to send it on to another hospital. Well, there's all sorts of rules about what you can accept and what you can't accept and how to do that so it's done right, so no patient is just left dangling.
5 years from now, what should we expect your organization to look like?
Well, it's been there for 40 years, so I think number one, it's going to be there. I think a lot of the projects that we work on will probably still be similar. I'm hopeful that in 5 years that the electronic record is such an established item that may be less of our focus, and that we're benefiting from that. One of the things we see right now is these measures that hospitals have to record, incredible number of them. They often have to look at the chart themselves and have someone search through it to find out the items so they can do it on a checklist. We're hoping most of those things get to be electronic, which will save a tremendous amount of time. Big hospital systems, it's not that big a deal. They have a department of 10 people in the quality, and a small hospital, that nurse who's called the quality leader is probably also the infection control and probably has one other job on top of that. So incredibly difficult for small hospitals.
Dr. Glynn Lytle is with the Foundation for Medical Quality. Thanks for coming on The Verdict.
Yeah, thanks.
I appreciate it.
Appreciate it.
Congratulations on the 40 years.
Thank you.
Kent and I will have a final word when we return.
Good life comes naturally to Tulsa, where nature's beauty is matched with an eye for aesthetics. A legacy of neighborhoods graced with lawns and landscaping and handsome homes. A place that seems to have patented an ideal lifestyle. Bank First is loyal to the quality of life Tulsa assures its citizens, to the priority placed on education, culture, and growth. Loyal to builders who transform raw land into residential charm. Developers who see opportunity and add vitality to Tulsa's economy. Bank First serves both enterprise and private lives that need a loyal partner. It's how we help nurture this city's very good life. Bank First. Loyal to Oklahoma. Loyal to you.
All children deserve a life of hope and love, but sometimes they experience a life of pain, neglect, and abuse.
When that happens, each child deserves all the quality assistance and representation that can be offered in our legal system. For more information, call 23-CHILD.
Oklahoma Lawyers for Children, helping to bring hope and love back to the lives of abused children.
The Journal-Record is pleased to be a sponsor of the verdict. The Journal-Record, since 1903, the best source of Oklahoma business news and legal information. And for almost 30 years, Oklahoma political, government, and business leaders have turned to the McCARVILLE Report for accurate, reliable, inside information. Visit the McCARVILLE Report online.
Yep.
Welcome back to the set of the verdict. We are wrapping up a show with Dr. Glynn Lytle with the Foundation for Medical Quality. They're doing a lot of good work.
Well, they really are, and with as many folks in Oklahoma as on Medicare, and that number is going to increase consistently over time, their work will be more and more important. I was interested that that's a place that if a Medicare patient feels like the treatment has not been what they hoped for or what they expected, they got a voice there that they can make a complaint or make an inquiry.
Good
I didn't know that existed.
I didn't either. And good message also about the ABCs.
Yes.
Aspirin, high blood pressure, cholesterol, and then smoking being the apostrophe
That's
S
very
on ABCs.
good.
I paid attention. We have some website information. If you'd like to get more information about Dr. Lytle or his organization, you can go to their website at OFMQ.com. That's OFMQ.com. And we also have a website. We'd love for you to visit there and tell us about a guest you'd like to see or a topic you'd like to see discussed on a future edition of The Verdict, and we will take that into consideration. For Kent Myers, I'm Mick Cornett. We'll see you here next week, right on The Verdict. See you then.
The preceding program was produced exclusively for the Cox Channel.